Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona. Today I want to continue our talk about headaches. We're going to talk mostly about migraines. This information is from WebMD. I encourage you to go there to get some more information. The reason why I have this on the screen is to touch on it, if you will. But I want to talk about some of the different causes of migraines, some of the different ways we treat those migraines as well. So typically when a person comes in to our clinic, they're typically going to be female when they have migraine headaches. Now males can get them of course as well, but you might have the nausea, the vomiting, the sensitivity to different noises. And those are all very common, but not everyone's presentation is the same. So it's always important with any kind of headache to determine where the problem is coming from. And we're very good at that. We have many years of treating headaches under our belt here. And so one of the things that can be causing these headaches is hormone imbalance. If it is hormone imbalance, it's easy to find out what's going on with a simple blood test. If that is the case, we can treat that here. We do that very well, but typically that's not as common. Anytime you do have a migraine headache, there's a bundle of nerves in your head called the sphenopalatine ganglion. We'll abbreviate that as SPG for short. So anytime you get these headaches, this gets overactive and it causes all these nerves to just basically generate pain. And it can be very painful. So one of the ways I used to treat this is they would actually take your jaw, your face, they would remove it, they would cut it out, they'd pull it out like a drawer, they'd come in here and desensitize that, or basically try to remove it. But what would happen every time is that by the time they put the face back in and it healed, this would regenerate. So they stopped doing that. And who wants to do that anyway? So they have developed something called an SPG nerve block. Now there's different ways to do this. Okay, this website here is just some guy I don't know, but it gives you more information. So feel free to look at that if you want to. So they used to go in there, and some people still do, and they'll put Q-tips up your nose with some medicine on, and they hope that that medicine reaches back here and basically desensitizes that nerve. But you have to keep the Q-tips in each nostril for up to half an hour, and it just doesn't work due to the anatomy of where the bundle of nerves is. So this genius gentleman a couple years ago, this medical doctor, developed this applicator that fits perfectly in here, and it targets this bundle of nerves very, very specifically. By targeting this bundle of nerves specifically, you're going to get quicker relief. You're going to use less medicine, and it works very well. You might not have a migraine for up to 6 months. So if you have these migraines that affect your life in this negative manner, just imagine if you don't have this for up to 6 months. So it works very, very, very well. The other thing that we typically are going to look at are food sensitivities. If you have something that you're eating that's causing inflammation and swelling in your body, your blood vessels, your nervous system, you're going to get headaches. Now, everyone in the world has a food sensitivity. They're just unaware of what it is. So what we do is we just draw a sample of blood. Okay, we run it through a lab report. We can give you a report up to 226 different things that you should and should not eat. It works very, very well. If you can target what you should and should not eat, well then you know what to stay away from. You don't have to just take general recommendations like cheese or wine and stay away from them. Now you know exactly what those things are. So that works very well. What we're going to do here is at the end of this video, I want to show you a video of how the SPG nerve block works. It's very quick, it's very easy, so we're going to put that at the end here. And then if you have headaches, if you want to learn how to get rid of them, if you want to learn some more information about it, feel free to go to our website that's at the end here, follow the link, and you'll find out how you can come in for a free consultation. Thanks for watching. So what we've got here is Avalon is getting the medicine ready. The medicine is just a local numbing agent helping to desensitize the nerve. So she's putting it in his nostril. She puts a little pressure on the plunger. The medicine goes in. She's done with that side already. He blows his nose. That gets the medicine moving more. She's getting the medicine ready for the other nostril. She go ahead and put that into the other nostril. That will numb that area as well. And boom, she's done.